I decided to do not the same procedure on the full face, but to divide the areas and to decide where to be more or less aggressive. Why we will be less aggressive to feather the results, to have a uniform aspect of the skin, but we will be less aggressive in these other areas. Immediately after the marking I put on her face, we clean the face. The skin must be absolutely dry to do the procedure. I will start with the more severe area, so I use high settings, and I'm using VoluDerm. Now we have to move on the central part of the forehead, but because of the thickness of the skin, we have to reduce energy as well as pulse duration. So I move down the pulse duration and the energy, and I will cover this area. Again, stretch the skin, enlarge the area. So, okay. You can see how fast is the procedure. It's like having a rhythm. Here, please, the sounds. So I go down again to feather the results, to do all other areas. Look, focus on my left hand. I push the skin up, so having as less as possible bone in the handpiece. Then I leave the skin and I follow the mark. How is the feeling, madam? So in a scale from 0 to 10, how much is the pain, for example? So in una scala da 0 a 10, quanto è il dolore?
The pain is like 3.
Again, as before, the pain is 3. So I want to move to the already treated areas. So stretch the skin, but look at the handpiece in this moment. We covered the area in this direction before. Now we have to rotate to 45 angle degrees and we can cover. So in the more affected areas, we are doing 2 passes, while in the area with less severe, we did only 1 pass. The chin, we can go just to the border between the red and the white part of the lip to have an improvement also there. On the philtrum, stretch the lip down, rotate according to the angle of the handpiece, put the tip on the handpiece exactly on the filter, and you can cover that perfectly. We can conclude the forehead. At the end of the procedure, we will apply an ointment on the skin, and we are asking our patient to avoid the sun protection only for the hours the redness will stay there. So I think that's no more than 2 to 3 hours. I have to cover as a second pass the central part of the forehead. So again, instead of on this way, I rotate the handpiece, and so I am sure that I'm not going inside the same hole we created with the first pass. No bleeding at all. That is fine. So the minimal redness you can see after the procedure help you to see where you did the procedure and where you didn't. So it's very easy to see, okay, line correct, fine. Lips covered, the tip is okay, borders is okay, here is okay. Here we skip a point, so we can do another shot over there. So I love this patient. She's a beautiful woman. So I put the tip of my finger on the orbital bone, protecting the eyes, but more important, knowing where I am. Elisabetta is enlarging and stretching the skin, and I affecting the crow's feet wrinkles. And we will have an improvement also on the crow's feet area. So thanks again. What about the pain? Come è stato il dolore? How was during the procedure? Nel secondo passaggio più alto, più basso? During the second pass, higher or lower?
I think the same. I didn't feel the difference between the two.
Okay.
this time.
So despite I decreased the energy, she didn't feel any difference. Look, this is a very homogeneous procedure. Love it. Thank you very much.